On Sunday, June 8, 2014 at 6:30 p.m., the annual Fundraising Gala and Awards Dinner of the Hepatitis B Initiative of Greater Washington, D.C., also known as HBI-DC, took place at the China Garden Restaurant in Arlington, Virginia, a suburb of Washington, D.C. The Hepatitis B Initiative of Washington, D.C. is a nonprofit organization dedicated to providing hepatitis B education, free screenings, vaccinations to at-risk populations, including Asian American, Pacific Islander, and African communities, and treatment referrals for low-income and uninsured individuals in D.C., Maryland, and Virginia. The theme of the gala was Together We Can.
I'd like to introduce our first guest speaker, Leslie Sue O.
I thought I'd share with you the story behind our logo. I was 24. I had just finished my first semester at Harvard School of Public Health. My mother had died 3 years earlier from hepatitis B at the age of 51. My brother had died the year before that at the age of 18, also from hepatitis B.
Hepatitis B is a virus that causes liver disease and is known as a silent killer because up to 75% of infected individuals don't know they are infected. Early detection saves lives. Among the guests of honor were Delegate Mark Keem, Julie Koo, Executive Director of D.C. Mayor's Office of Asian and Pacific Islander Affairs, and Grace Han Wolf, Member of City Council.
You and I, using our voice, can go out there and change the world one life at a time. And if your voice and your action can stop one more person from dying before his or her time on earth, then you've done your job, and you deserve all the praise you deserve.
I'm very glad to be here today. Like I was here last year. The Virginia General Assembly passed a resolution designating May 19th of every year as Hepatitis B Awareness Day in Virginia. And I was very proud to be the one that sponsored the bill and got it passed unanimously. The reason why it's so important is because not many people understand that hepatitis B is a concern. It's a virus that's out there that affects thousands of people, and yet it's an easy thing to detect if we get screened. But people just don't understand it. So we want to make sure that we raise the awareness so people understand that it's important for them to be screened.
Hey, thanks for this opportunity. There is no way that you cannot support Jane Pan and HBI Hep B Initiative. First of all, Jane Pan is a great advocate. She's a great inspirational speaker about this topic, amazing, and this issue is really important for our community. So I'm really happy to help out, and our office does a little bit of the support in funding, but yeah, really appreciate this opportunity, and I'm also really appreciative of their work in the community.
The keynote speakers were Dr. Jennifer Lee, Deputy Secretary of Health and Human Services, and Corinna Dan, Viral Hepatitis Policy Advisor.
This last year, under the leadership of Jane Pan, HBI-DC was able to educate over 2,800 people about hepatitis B, screen over 2,200 people, vaccinate almost 200 people, and identify almost 100 people who were actually infected with hepatitis B and link them to life-saving care. So the work, Jane, that you lead and that HBI-DC is doing in our community is truly saving lives.
It has been a pleasure to work with Jane Pan and the Hepatitis B Initiative of Washington, D.C. over the past few years to really raise awareness, get people tested and into care. It's a really important part of addressing Hep B in the U.S.
At this time, I'd like to acknowledge our leadership circle. We have 10 doctors last year, and these are the doctors. Each member of the HBI-DC leadership circles have committed not to screen their at-risk patients for hepatitis and have dedicated their volunteer hours in their busy schedule on weekends to help us to educate and screen and vaccinate at health fairs and at different events, at churches, at schools, at temples. I want to acknowledge Dr. Sam Tran.
I personally know Mrs. Pan for 6 years. From the beginning, the Medical Society of North America support her and help her to build up the project in Washington, D.C. and also in Virginia and Maryland. She worked for the Asian, and the Vietnamese communities need this training for Hep B. So therefore, we always support her to do her job for so many years. And lately, with the financial support, she has the money and also support back the medical society. She donates at least $5,000 a year for the health fair project for the Vietnamese Medical Society.
I'm working in the field of viral hepatitis for about 2 years doing collaboration with Jane Pan. She is fantastic, very active, high quality service for the community. So we did different programs in the community and also at Providence Hospital educating different providers like community activists and also physicians. Knowledge, education, awareness are powerful weapons. With that tools, we can create this understanding about these epidemics of hepatitis B and hepatitis C.
She's a very pleasant, capable lady. I never seen anybody so energetic, so helpful. And she really do everything backward for us. So because we've been working with her for the last 3 years, the Chinese Consolidated Benevolent Association in Chinatown, we have 4 health fair every year. So during the health fair, we do all the blood testing, screening, and also screen for hepatitis B, and also now recently we screen for hepatitis C. When the patient need to have vaccination, so she provide the vaccine. She's been wonderful.
I have been collaborating with Ms. Jane Pan, who is the executive director of HBI-DC. She is a very active and wonderful person who takes this job very seriously, and she wants to make sure that all minority, Chinese, Korean, Vietnamese, Laotian, Burmese in the area are educated with hepatitis B. She also have a lot of connection with the state government level as well as national government level that help to promote the HBI-DC activity in the Washington, D.C. area. I have a privilege to work with Jane Pan for the past few years, and I'm very supportive of what she's doing. And I hope to have more of these get together and for fundraising for this important cause in the future.
It was quite a successful event. There were over 200 attendees, which included government officials, medical professionals, and people from the Chinese, Korean, and Vietnamese communities. The event concluded at 9:30 p.m.